Yeah, I think I put together last night and this morning about 25 slides, 25 or 30, I don't remember. And my plan was to go through all of them with you today, and then on our subsequent lectures, we'll go through them in a little more detail, a little more slowly. That was kind of my plan. We'll see how that works. And my kind of the aim or my purpose is to give you a little bit introduction into how modern medicine doctors think. Okay? How do they think about, disease? And so that's kind of, this will be the first. Let's say disease is a big room and it has many windows and doors. This will be one of the doors or one of the windows to see how modern medicine doctors approach disease. First trying to figure out what it is, and then later treating it to the best of their ability. Okay? So that's my overall reason for picking this topic. It wasn't solely mine. Your dean, Rakto Rinpoche Amchila Lobsan Tensala, he had input. Your vice chancellor, Geshe Ngowan Samtenla, he had input. And also your, I don't know exactly, Tashidawala's, is he a research assistant or is he assistant professor? What is he? Huh? Assistant professor. Tashidawala. You know that Tashidawala is my student. Did you know that? Huh? I was here a few years ago teaching as a visiting professor, and in fact it was before Tashidawala went to Emory, and he was a senior student at that time, and he was one of my students. So we maintain a close relationship, which is very, very nice. Okay, so let's see what we can do. So the topic I've given is differential diagnosis. What does that mean? What do you think? It's okay, give it a try. You don't have to be right. What does diagnosis mean? What do you think? Just give me in simple language. What does diagnosis mean? What's the Tibetan word? Huh? Taktam? Tap pop. Tak pop. I can't get it. Tatap. And what? Huh? Tap. Tapshitap. Tapshitap. And what does tapshitap mean? What does it mean? Tell me in English or Tibetan, either way. Huh?
The method of treating.
I'm sorry?
The method of treating.
A method of treating. Oh, tap is a method, exactly. Method of treatment? Treatment. Oh. Okay. So in modern medicine, diagnosis has a little different meaning. It's before we treat. It's trying to figure out what's wrong with the patient. Okay? In simple terms. That's diagnosis. So for example, someone comes into the doctor, modern medicine doctor, and says, "Doctor, I have a headache." What's your diagnosis? Huh? What's your diagnosis at this point? What is it? No, before you ask the reason, right now, person comes in and says, "Doctor, I have a headache." At that moment, what's your diagnosis? Headache. Yeah, headache. Okay. Then you have to figure out, well, what kind of headache? Okay. Then we get into differential diagnosis. Differential kind of means like dhammada. Different types. Dhammada. Okay. So then we get into differential diagnosis because we don't know at this point. Patient comes in, they say, "Doctor, I have a headache." So there's many types of headaches. Okay. So we don't know which type. Okay. So we're developing a differential diagnosis. All the Dhammada, Sipa Re, Sipa Mare, what's possible? Types of headache for this person. So we have to get more information, right? So you all would check a pulse, look at a urine. Some of the doctors look at the tongue, look at the face, complexion, things like that. Maybe ask some questions about diet and behavior, lifestyle. Okay? And all that is to get more information to refine our diagnosis. So at the beginning, our differential diagnosis may have many different things. For example, headache, okay? We may think, oh, this person has tension under stress. Okay? Do we need translation? I can't ask who wants it because you're shy, you won't raise your hand. But how many people are comfortable with my English? Raise your hand if you're comfortable with my English. So a few of you, maybe not. Most of you, okay, very good. Should we do a little translation, maybe? What do you think? Not necessary, maybe? Huh?
No, I don't think.
Sure? Please don't be embarrassed or shy. Okay, if something you don't understand, raise your hand, okay? Please, and I'll try to explain it in a little different way. Okay, so right now the patient comes in saying, I have a headache. So our differential is several things. Tension headache, okay? Maybe the person has something serious, particularly if they're a little bit older, brain cancer, or younger or older. Kids sometimes get brain cancer, as do older people. So I might have brain cancer in my differential diagnosis. These are the possibilities, okay? I may have migraine. Do you know migraine headache? Do you know this one? Some of you are shaking your heads. Migraine headache is always one side of the head. Okay? Often the person is very sensitive to light and sound when they're having a migraine headache. They may have nausea. Do you know what nausea is? Raise your hands if you know nausea. You're not bad. Gyupa gyup sowa. Gyupa gyup sowa. Feeling like vomiting. Or they may have vomiting. Often this is in the family. They may have a pungya, a relative that has a migraine, one-sided headache. So that's in the differential. Aneurysm. Cerebral means the brain. Aneurysm. Aneurysm is a blood vessel, an artery. Okay, the one that you check for your pulse diagnosis. That's the radial artery. Boom, boom, boom. That one. Okay. Those arteries are everywhere in the body, even in the brain. Sometimes people are born with a little defect. Kyonyore. Ditsaki kyonyore. It's a little outpouching. Here's the artery like a tube, and there's a little like this. Okay? And that can rupture because the walls are thin. So maybe the person is having a ruptured cerebral aneurysm. In the differential diagnosis, the possibilities. And then there are some others, okay? And then what do? How do you find out which of those possibilities is correct? Well, how do you do that? What do you think? What else would you do? Excuse me? Again, please? Symptoms. Very good. So you talk to the patient. You say, what's happening? What symptoms do you have? What problems are you having? And they say, well, doctor, every morning I wake up with a headache the last 3 months. Wake up with a headache. When you hear that, you get nervous as a doctor, because that could be serious. Okay, 3 months also could be serious. So you get symptoms. What's the patient feeling that's not right? Something that's bothering them, particularly related to the headache or even separate from the headache. So you talk to the patient. We call that taking a history. Okay? It's called taking a history. You ask about different symptoms. Okay? Are you feeling weakness? Are you feeling any loss of feeling in your arms or your legs? Are you losing the power in your arms or your legs? Are you vomiting? Okay. These are all these questions to find out which of these differential diagnoses is going to be correct for this patient. So first you ask about symptoms. Then what do? First you take a history, talking to the patient. Then what do you do after that? You do the same thing as I do. What do you do? Huh? Check a pulse. So what's that general category of checking a pulse? You examine the patient. You do a physical examination. In your case, you're going to primarily do a pulse. You're going to look at the tongue, you're going to look at the face, do some observation, but mainly you're checking the pulse. Okay? From modern medicine perspective, they do we call a physical examination. That's the term, physical examination. So usually doctors don't have much time, but the full physical examination is from the top to the bottom. Okay? You look in the eyes, ears, you look in the mouth, check the neck, particularly the arteries, check the thyroid. Then you listen, the stethoscope. You use a stethoscope. You listen to the heart. You listen to the lungs, okay, with the stethoscope. And then you check the belly. Usually you do that by, one, you listen with a stethoscope. Listen to the sounds of the gyuchen, the large intestine. Is it active, too active, less active? You listen for that. Okay. Then you check with your hands, usually lightly. If you press too hard, then the patient's going to tighten up their belly muscles and you can't examine anymore, okay? So very light touch and not cold hands. If your hands are cold and you touch the abdomen, the belly of the patient, just like for you and me, they're going to tighten their muscles, right? So warm hands and ideally warm heart with a smile, because they're going to be nervous. They're going to be fearful. When you go to the doctor, you're afraid. I'm afraid. So make them relaxed. Smile, talk a little with them, and then check the abdomen, the belly. You're checking see if the liver is enlarged, the spleen is enlarged, and if there are any abnormal masses, something like my fist, that you can feel inside the belly that might be cancer of the stomach, it might be cancer of the colon, okay? And then you check pulses. We check pulses in the neck, the big arteries. Okay, these are the carotid arteries that supply most of the blood to the brain. We check the arteries in the groin, okay? That's the femoral artery. Good. So we do physical exam, to find out. So we call these signs. Okay? Tak, right? Tak. Signs. Tak. I'm sorry, my Tibetan's not so good. I know the ta and the tak are a little bit difficult, but okay. So we look for it. Those are called signs based on the physical examination. Symptoms are from talking. We call that the history. Okay? So we get symptoms, then signs, then what do? You do the same thing. What do we do next? Huh? Tipa. What do you do next? What does Yeshidundan always do? Amjila. What does he do? Huh? Huh? Yeah, what? Urine, yeah. So laboratory. Next is laboratory. So Amti Yeshi Dundala, he's always checking the urine, right? Mensakong doctors don't check the urine much anymore, most of them. They get lazy, I think. But Dr. Yeshi Dundala, always checking the urine, okay? So laboratory is next. Just so same. Modern medicine doctors, then they go to laboratory, okay? So laboratory may be an x-ray, okay? It may be some blood work, ta kitakche, checking the blood, different, tests on the blood. Maybe urine, chimba, takche, okay? And then there are other types, but those are the basic ones we may start with. Maybe an x-ray, blood test, urine test, okay? Good. Then we get more information. And with this new information from our symptoms, our signs, okay, so from our history, talking, our signs, examining, the physical exam, and then our laboratory, then we collect all that data. And then we again look at our differential diagnosis. Our patient came in with headache, okay, and we had in our differential diagnosis tension headache, right? We had malignancy, cancer, okay, brain cancer. We had an aneurysm, a cerebral aneurysm in the differential diagnosis, right? We had one more. What else did we have? You remember? Migraine. So we had migraine headache in the differential diagnosis. So our job now is to exclude those differential diagnoses that are not appropriate for this patient. So how do we do that? Any ideas? Okay, let's say the patient, so first thing we want to know, is it an old or a new headache? Okay, that's in our history. So we ask, how long have you had your headache? And they say, well, it started yesterday. So it's a new headache. Or they say, I've had it every day when I wake up for the last 6 months. Old headache. In the category of new headache would be tension, okay? Could be migraine, could be cancer, but very unlikely. Maybe the first time they got a headache with a cancer, but most patients with brain cancer, they've had the headache for a long time, okay? Aneurysm comes on suddenly when it ruptures, a cerebral aneurysm, suddenly. And it's a severe, severe headache. So then what's the next question we want to ask? How severe is your headache? On a scale 1 to 10, where 1 is very, very mild, and 10 is like someone took an axe and cut their head in half, terrible. What number what would you say? Well, doctor, maybe a 3. Okay, not so severe. So that will rule out, at least kind of rule out, an aneurysm, ruptured aneurysm. So that's how we go about. That's the way the doctors think in terms of differential diagnosis, and then gathering more information through a history, talking, physical exam, getting signs that you can find on your physical, and then lastly, laboratory. Okay. So this is you guys. So Rigpa. So, different ways to classify disease, okay? First one is we call etiology. It's a very strange, almost, I think it's a Greek word. It just means cause. But you'll hear that word when you hear doctors talking, modern medicine doctors. They'll say, well, what was the etiology? Yeah? They mean, what's the cause? It's a good word to know, okay? Etiology. You'll get copies of all this. I'm going to give the slides to Rinpoche, to your dean or Tashidola, someone, and they'll make these available for you, okay? Second way that we classify diseases we call pathogenesis. What does Genesis mean? Some of you know. What is Genesis? If you were Christian, you would know. Maybe there are some Christians here. Okay, the book of Genesis. I'm Buddhist, I'm not Christian. But the book of Genesis is all about creation. So it means cause or create. What caused or created the disease? So from that perspective, okay, we can classify different diseases. And patho means what? It's Greek, I believe, again, yes. It just means not normal. We say sometimes pathology. It means abnormal, not normal. Okay? So pathogenesis means what's the cause of the abnormality, or we could say disease. Okay? And then lastly, by symptoms. So for example, when I said that our differential diagnosis, when the patient came in and said, "Doctor, I have a headache," our differential starts with headache. And that's classification of disease by symptom. Headache is a symptom, right? It's subjective. It's what the patient is experiencing. Okay? It's not something we found on our examination or in our laboratory tests. It's what they tell us. That's a symptom. Now here's an example of diseases classified by cause, similar to pathogenesis. And this is infectious disease. Okay? And this is very common. This is the way modern doctors look at infectious disease in these four categories. Okay? Bacterial, viral, parasites or parasitic, worms, giardia, amoeba, all that stuff, hookworms, tapeworms, many of them. And then fungal. Okay? Anybody have athlete's feet here? I bet a bunch of you do. You know where you have a little crack between your toes and it itches, and yeah, I've got it. Okay? Or your nail, usually on the toes, turns kind of yellow and thick. Yeah, some of you have it. That's a fungus. So that's an example of a fungal infectious disease. Okay? We call that tinea. Tinea just means an infection of the nail or the foot. Okay? By a fungus. Okay? It's an example. Now this is maybe not so necessary, but the pathogenesis, remember patho means disease or abnormal disease, and genesis means to cause or create. Okay? So what's the cause of the disease? It's looking at a biological mechanism. So pathogenesis is looking at what's the kind of mechanism, kind of like top, not quite. In English it works, it doesn't work in Tibetan, not quite top. The biological mechanism underlying the disease. Okay? Okay, that slide's not so necessary. Okay, this got mixed around when we put it on your projector. So these are a few examples of pathogenesis, of classifying disease based on pathogenesis. Okay? Infection or inflammation, they're close. Different, but they're close. Okay? That's one category of how we classify disease. Or what does malignancy mean? What's the other word for malignancy? Excuse me? What is it? The C word. You know the C word, don't you? What's the C word? Cancer. Yes, yes, yes. Modern medicine doctors often say malignancy. There's one other term we use, neoplasm. Neoplasm. And they all mean cancer. Okay? Cancer is not always a bad word. Okay? doesn't always mean you're going to die soon. Many cancers are curable. And many cancers are very slow growing. So even if the person does die from it, it may take 10 years or longer, 20 years. Different kinds. And each cancer has a whole different style, a whole different way that it affects the patient. So all cancers are not the same. And every organ has a cancer. Brain cancer. The heart has, but it's very rare. Okay, there is, but very rare. Lung cancer, colon cancer, stomach cancer, what do we say, chronic disease, nasaningpa, right? Troge nasaningpa. Stomach cancer, very common in exile, Tibetans living outside of Tibet. Very common, unfortunately. And you have friends or pungya probably that have had stomach cancer and maybe died. Okay, it's common. And then the last, so the first is microbial. I missed that. That means infectious disease. Microbes are boo. Okay, bacteria, viral, parasites, or fungus. This is the last of my Bodhgaya cold. When I talk, it irritates. So microbial are the infectious diseases, bacteria, virus, parasites, and fungus. Okay? And then degenerative. I said tissue breakdown. Degenerative. These are when we get older. It's about time for you guys to talk. So these are like, for example, when your knee, you get a bad knee when you get older. You know, normally in the knee you have the two bones, like this, and you have a cartilage pad, like your ear, this stuff, okay, in between. It is it's like a cushion between the two bones. When you get older, that wears out. That's an example of a degenerative disease. We call it osteoarthritis, in this case of the knee. The cartilage tissue breakdown degenerates. You know older people that get Alzheimer's disease or other dementias, you know? And they, start losing their cognitive ability, their mind, okay? Their memory first goes. Sometimes they have personality changes. Maybe they start getting angry and irritable, okay? That's a degenerative disease of the brain, dementia, okay? Also, we classify diseases according to the organ system. What are organs? What are they? I think the word is kam, maybe in Tibetan. Yeah, kam? Huh? Kam? Organs. Brain, heart, lungs, liver, kidney. Huh? What? Wangpo? Wangpo. Wangpo. Okay. Wangpo. So we also classify disease according to Wangpo, organ. For example, we would say diseases of the brain. We would look at infectious diseases. We would look at degenerative diseases. We would look at malignancy, okay, cancers. Okay. Then we would look at diseases of the lung, Loa, right? Loa? Yeah. And we look at all the different diseases of the lung. Okay. So that's a classification of disease by organ. Okay. So that's the boring stuff, okay? Now I think maybe soon, I have one more, okay. So this is an example by organ, how you classify diseases by organ. Which organ are we talking about here? Huh? Lungs. Yeah, so that's what respiratory disease means, diseases of the lungs. Okay? Good. Lokinasa? Huh? Huh? Loine. Loine. Okay, good. So what's COPD? What is that? Very common. Huh? Yeah. Chronic, yes. Very good. Good, good. It's chronic. Who gets this? Which people get this? Sorry? Tamata. Huh? Who gets this? Huh? Who gets this? Smokers, yeah. The smoker's disease. Not one day, but 20 years. Okay, long-term smokers. They get this. Chronic, exactly right. Long-term. Obstructive means guk, blocking. COPD, what is it? Chronic obstructive. Yeah, P, what's P? Yeah, I heard it. Pulmonary, exactly. What does pulmonary mean? Huh? Lungs, yeah, good, good. So you're learning the vocabulary, very good. And what's D? Disease, yeah. So chronic obstructive pulmonary disease. It's too long, so we usually say COPD. Okay, COPD. It's a disease of smokers. What happens? What's the pathophysiology? If you looked inside the lungs of someone that died with COPD, you did autopsy, what would you find when you cut open the lungs? What's the disease? What is it? Huh? Okay, so what's the lung normally? If we opened up a lung, a living, normal lung, what does it look like inside? Huh? You've had this, you studied this. You had anatomy. Yeah, no? No. It's air sacs, like little balloons, like 1 million or more than of them, okay? Tiny little air sacs, like little balloons. And in between will be little tiny arteries, okay, and veins. Okay? And when you smoke, long term, those little air sacs, they break. So 100 little ones makes one big one, or even 1,000 little ones makes one big one. We call those bulla. Bulla means just big air sacs. And if you have only one rather than 1,000, what happens to the exchange of oxygen and carbon dioxide that happens in the lungs? Obviously less effective, right? You can't transfer oxygen and CO2 as efficiently. So what happens to the patient with COPD? What are their symptoms? Huh? What's their experience? Yeah, they can't breathe very well. Exactly. Trouble breathing. Yeah, exactly. There's two types. One gets very thin, and one gets a little bit fat, big chest, front, back, big chest. Okay, they're trying to breathe, they're trying to compensate because they can't breathe well, their lungs aren't working properly. Okay. Asthma. Anybody know what asthma is? What's asthma? Huh? What is it? Uksa, yeah. Where the small airways kind of constrict. So the air doesn't pass well. That's what modern medicine says. Okay? So, like that, okay? And what's bronchitis? Huh? Loininka. So we say there's acute and chronic bronchitis, both. Acute is like a cold, like a jampanaza, but coming from a little deeper, okay? And there's also a chronic form. Maybe loiningpa is the chronic form, maybe. Ningpa? Ninka. Oh, I say, sorry. Infection. Oh, I see. So right. Good. And then what's pneumonia? Lung. Good. Infection in the lung. Very good. And sorry. Sorry? Children. You can see it in, that's right, usually in children or older people. Most people die of pneumonia. That's the last thing that kills them. Most people. Older people. But you also see it in children. Yeah, exactly. And often it's pus. Knock. In the lung. So it's a more serious form of infection. Okay? And then what's pulmonary embolism? What's an embolus? It's a blood clot.
Is it similar to bolus? We call it the chewed food. Bolus?
No, very good question. No, it isn't. But that would be we call that a aspiration when you get a food down the wrong pipe. Different. That is a bolus, you're right. This is embolus, it means a blood clot. Similar word in English. Thank you. This is where you get a blood clot and it goes to the lung and it can be serious. People die of this sometimes. So that's an example of dividing diseases based on organ. In this case, the lung, loa. Okay? I think that's all the boring stuff. Oh, a few more. I'm sorry. A few more boring stuff. So these are some general categories that doctors think about, modern medicine doctors think about in terms of disease. So some of this we're repeating now, okay? Some of it's repetition. Inflammation or infection. Inflammation. What's an example of inflammatory disease? Can you give me an example? Inflammation disease.
Hepatitis.
Huh? Hepatitis. Very good. Hepatitis, we more consider an infectious disease. There are different kinds of hepatitis. Some are infectious, but some could be inflammatory. You're right. Good. Hepatitis B, C, these are viral infectious diseases. But very good, very close, very nice. So one simple example, have you ever twisted your ankle? You're playing sports, you're playing soccer, football, and then you just twist an ankle and it swells up? That's inflammation. That's an inflammatory traumatic or trauma. You boom, twisted an ankle and it got swollen, big. If you have inflammatory disease on the inside, same process. Things get swollen, big. Okay. Now, I told you this once. Anybody remember? What does that mean, neoplastic? What does it mean? I told you once. Huh? Sorry? Cancer. Good. Gold star. And we talked about degenerative. We gave the example of the knee in an older person where we get degenerative arthritis. Things just wear out. We talked about the old person that loses the memory. Okay? We call that dementia. That's a degenerative disease of the brain. This is new. I haven't mentioned it yet. Congenital. What does that mean? Huh? What? Please, a little louder. Go ahead. It's okay. Please. Who said that? Stand up. 2 gold stars. By birth. Exactly. So we're born. Sometimes we're born with some kind of a problem in the body. In fact, in the developed countries, they say about 4%. Okay? 1 out of what? 25, I think. Yeah, 1 out of 25 babies born will have a congenital defect. Okay? It's a high number, right? And in, less developed places in the world, like India and maybe rural China, the number's higher. Africa, even much higher. Okay? And what are congenital defects? Give me an example. Do you know? You know. What are things that people are born with that are diseases or abnormal? Have you ever seen anybody with an extra finger or toe? Yeah, sure. That's a congenital disease. Not a big problem, but it's a congenital disease. What else? What else can people be born with congenital disease? Yeah, virtually every organ in the body. But the important ones are the heart. Have you heard of congenital heart disease? Do you know any babies that are born with that? Yeah, some of you do. Okay. What about a cleft palate? You know, this is split here. You know people, of course. We have special camps where we bring surgeons from Bombay or other places once a year, and they repair them, okay? Yeah, that's a cleft lip. There's also a cleft palate inside here. It's split, and it may involve the lip or it may not, okay? Those are congenital diseases. There are many, many others. There are congenital diseases of the stomach, where the opening of the stomach into the small intestine is shut. So the baby starts vomiting, can't pass the food, needs a small operation to fix it, okay? And many, many other congenital kinds of diseases of the kidney, of the large intestine, many, many others. Of the brain, okay, the brain. So there are many types of congenital diseases that we're born with that affect virtually almost every organ in the body, okay? And then drugs. What's this? What does that mean? If you take a lot of cocaine, you know, what happens to the septum in your nose? You get a hole. Okay? So that's a disease caused by a drug, cocaine. And lots of other things, okay? If you shoot up heroin, and now we have more and more young Tibetans doing that, unfortunately. Yeah, in Dharamsala. I don't know about Sarnath. I hope not, but maybe. And then all kinds of problems, okay? And we don't have to go into that now, but all kinds of problems. It's a real problem, okay? Okay. And autoimmune, that's where the immune system is not working properly. It attacks itself. So your immune system thinks that one part of your body is foreign, and it attacks it. One example is rheumatoid arthritis. Have you ever heard of that? Some of you shake your head, yes. Okay. And that attacks the joints, but also some of the organs, like the lungs particularly. Okay. Allergic? Anybody have allergies here? Rhinitis? You know, you sneeze and nose gets blocked. That's an allergy. Asthma is an allergy. Okay. What did you say for asthma? Sorry? Yeah, Tibetan word? Mitopa? Mitopa. For allergy. Good. And what about asthma? Someone said asthma here. Usa. Utsa. Uks. Uks. Like breathing. Uk. And utsak. Ukmidewa. Yeah, good. So those are allergies, okay? Okay. So then trauma. What's trauma? Depression? Not quite. It is a type of trauma, but generally when we think of trauma, we're thinking of physical things. There is, you're right, but generally we think of physical things for trauma. Accident, right? Accident. Car accident, you broke a bone, you were playing with a friend and it got too rough and you hurt yourself. Trauma. Okay. Endocrine is like the hormones in the body. Give me an example of one hormonal system in the body. Huh? Sorry? Testes, ovaries. Yes, exactly. So we call those the sex hormones, or what else do we call them? Yeah, the sex hormones related to the genitalia. Yes. What else? Adrenals. Exactly. That little thing that sits on the kidney is called the adrenal gland. Makes a lot of hormones. What else? Pituitary. Boy, why you guys study this, huh? Where's the pituitary? Brain. Where in the brain? Close. If you go right in between the ears and right between the front and the back, that's where it is. So it's at the base of the brain, right in the middle. Pituitary. Very good. What else? Thyroid. Where is it? Yeah. No, higher. Yeah. Good. Here. Just below your Adam's apple. We call that the Adam's apple, this guy. You're right here. Good. What else? One other big one. Sorry? Hypothalamus. That's in, yes, exactly. The hypothalamus is in the brain, more central in the brain, hypothalamus, and it's involved with a lot of the different endocrine systems in the brain, the hypothalamus. Good. What else? Another endocrine organ. Huh? Sorry?
Prostate gland.
Again?
Where semen is produced.
What's produced?
Semen.
Semen. So prostate.
Yeah.
It's a very good answer. Not quite. In the endocrine system. It's a very good answer though. There's one other big one. Huh? No, it's just in front of the liver. Not the liver. Just in front of the liver and the stomach. What is it? What's the disease? Endocrine disease. Very most common. Chininasa. Yeah, pancreas. And what's the disease? Huh? Yeah, diabetes. Yeah, chininasa. Good. And then metabolic, well, that's a little more complicated. It has to do with chemistry inside the blood that is abnormal, out of balance. Okay? An example of a metabolic condition would be, okay, the case study that we're going to do shortly, maybe today, tomorrow, she was acidotic. Normally the blood has a pH of 7.4. You know about pH? You guys study that? Yeah? 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 No? Okay. Some of you had it in high school chemistry. Some of you had it. What's the pH of water? Take a wild guess. Wild guess. Huh? Just a wild guess. 29? 2? What is it? Water. Huh?
Acidic and alkaline.
Yeah, so it's balanced, right? It's not acidic, it's not alkaline. Therefore, the pH is? What's normal? That's my question. Good, you're right. What's normal? I just told you. 7.4. That's the pH of water. It's neutral. It's neither. It's not acid. It's not alkaline. It's a normal pH in the blood. This woman was 7.2. So her blood was very acidotic. Okay? And it had to do with her breathing very fast. And that's an example of a metabolic disorder. Okay? She was acidotic in her blood. Okay. Whoops, sorry, that's too fast. Environmental, what's an environmental disease? We suffer in India from it all the time. What is it? Yeah, pollution. What kind? Air pollution. The air is very dirty here, yeah? Not so much in Sarnath, but... Good. Okay, you want to do a case study? Now, what is a case study? I asked you before and I explained. You remember? Huh? Simple. What is it? Give me a simple answer. What's a case study? Yeah, it's a history. It's everything. It's a history. It's a physical examination, laboratory, a differential diagnosis eventually, and then even treatment, okay? So it's just basically the story of the patient. That's all. Patient's story. In terms of history, physical exam, laboratory, differential diagnosis, then kind of finding a diagnosis, then treatment. Make sense? A little bit? A little bit? Tiny, tiny? Pay, chum, chum. What's our time? How we doing? Am I over time? Have I gone too long? Chimila. Chimilamala. What time did we start? Anybody look at the clock when we started? Okay.
50 minutes nearly now.
50.
Nearly 50 minutes.
Nearly 50. Okay. Here's what I'm going to do. I'd like to run through quickly this case study. We'll go through it again, but I want you just to get a flavor, and then we'll open it up for questions, okay? And we'll continue on our next lecture. Now, tomorrow is Republic Day. Is that a holiday for you? Or do you have classes? So we're going to have class tomorrow? Sorry. Yeah, I just do what I'm told. I have no say in this. Okay. Actually, there's not much to do on Republic Day except sleep. You can't really go out much, you know, it's too wild and yeah. Okay, so let's go through the case study. This is a real patient and somebody that I actually saw and took care of 4 days ago. So this is a 20, usually start with the age and a little slight background, you know. So this is a 21-year-old Tibetan college student from Ladakh. She's Tibetan but her family, she's from Ladakh. She went into acute respiratory distress. What's that? What do you think? Huh? What's acute respiratory distress? What do you think? Any guesses? Just take a guess. What does acute mean? What does acute mean? Sorry? Serious. Here it means time. So acute means right now. Lamsang. Yeah? Acute, just happening now. It's not opposite of chronic. Opposite to chronic. Okay? So acute, and what's respiratory? You know what that means, right? What does it mean? Huh? Yeah, breathing. Yeah, breathing. And what's distress? What's that? Distress. Some problem, right? So she had a sudden problem with breathing. That's simple language. That's acute respiratory distress. A simple problem. Recent problem with her breathing. Okay? Severe dyspnea. So the terms I want you to know I've put in italics. Severe, you know severe, yeah? You know severe, yes? Means, what do you say? Not takbo. What do you say for severe? Huh? Sorry? Can't hear. What's severe? Mild, moderate, severe? What's severe? Strong, good. Yeah, strong, good. Good. And what's dyspnea? So the PNEA, it's the same thing in pneumonia. Remember we had that? It's a PN word. That always means lung. Loa. So what does dys mean? It means trouble. Kanye. Okay? So trouble breathing. dyspnea. And tachypnea. So P-N-E-A, what does that mean again? Huh? Lung, good. And tachy, you haven't had that word yet. What does tachy mean? Anybody know? Huh? Jopo jopo. Fast. So tachypnea means she's breathing fast. So dyspnea means trouble breathing, and tachypnea means breathing fast. Okay. She was taken to the hospital. I took her to the hospital. Her blood pressure when she arrived was high, 172 over 120. Okay, this is important for you to know. What's a normal blood pressure? What's the tsatsam? The dividing line between high and normal. What is it? 130 by 80. That's kind of a normal blood pressure. But what's the borderline? You know, the tsatsam. 140 over 90. That's our usual cutoff. If it's that or less, it's normal. If it's above, it's high. Now, to make the diagnosis of high blood pressure, how many blood pressure readings do you need to take? 1, 2, 3, 5,000. Saya cheek. How many readings do you have to take for the blood pressure to diagnose high blood pressure? 3. 3, not just 1. Okay. Her pulse was 170. What's normal? 75 is normal, correct. What's the borderline? Tsatsam. Above is high, below is normal. What do you think? 100. 100, okay? So she's got a very fast pulse, 170. Regular sinus rhythm, we won't go into that. Okay, you're getting bored. Let me give you 2 more slides and we'll go into question and answers. She had a chest x-ray, and I'll show it later, with pleural effusion. Just means water in the lung. Okay, thank you. And what's cardiomegaly? What's cardio? Heart, good. What's megaly? Huh? Megaly? Big. Huh? Big. Chimbo. So she has a big heart. Okay, why don't we stop here, okay? This is too much. Let's stop here and let's have a discussion. Why don't you make some comments or ask some questions or... It's a lot of material. I don't expect you to know it all in one go, okay? We'll do it more. We'll review it more. But this is kind of the way the modern medicine doctor approaches seeing a patient. In this case, a sick patient. Okay? Very, very sick patient. Please, please. Which term?
Congenital.
Congenital, yes. Please, please.
There are tests which are bone deformed. There are children who are born deformed from the radiation of radioactive. So, does it include in the congenital disease?
Very good question. What do you think?
Kind of.
Yeah. What does congenital disease mean?
Disease which leads to the lineage of his or her family.
Yes, yes. And technically it means that you're born with it. A disease that you're born with. So the case you presented, radiation exposure, while the baby was the fetus inside mother's womb, and then the baby was born with some defect in the bones. Yes, this is a congenital disease. Very nice. Good. Thank you. Thank you. I want to hear from a Puma also, please. Not just the boys, but the girls too.
Sir, I do have one simple question.
Thank you.
As you explained earlier, categories of disease, degenerative or deficiency.
Again, please, the last part.
Degenerative or deficiency.
Yes.
Deficiency.
Yes.
So my question is, what are the correlations between the disease that you categorized and the actually the degeneration means breaking down of tissues in vital organs. I mean,
Exactly.
condition.
Exactly. Exactly.
So as if we take in the natural phenomenon of our old aging people, so it means that there is difference between the degeneration between degeneration.
Yeah. Good. Good. Good.
In short, in brief,
Yeah.
what are the correlation between the degenerative or deficiency that you categorize under a disease and with the natural phenomenon of old age?
Old age.
Degeneration?
Oh, wonderful question. Wonderful, wonderful. So what your question is kind of asking is, what's disease? It's kind of underneath your question, is what is disease? Because as we get older, different organs, cells, the whole body degenerates. It kind of gets old. It gets worn out, just like an old car. So the question is, what's the difference between normal, getting old age, and degenerative disease? Very good. So degenerative disease is when things are not functioning well that create a problem. If there's no problem there, then not a disease. So literally, disease means not at ease, so like discomfort. So degenerative disease is when the breakdown of the tissues as we get older, usually it's with older people, it creates a problem. For example, I gave the example of the knee, where the cartilage wears out between the two bones in the knee, and then that causes problems for the person. Pain, they can't walk, or they need to use a cane, stick. That would be then a disease. On the other hand, if there was some degeneration in the cartilage in the knee, but it didn't cause a problem, they could still walk well, they don't have pain, then it's just ordinary old age or degeneration not correlated with disease. So the difference is whether or not it causes a problem. Good. Thank you.
By now we came to know that differential diagnosis purely means a different method of finding out what the patient's exact problem is.
Mm-hmm.
So in case of emergency, if when the patient and the doctor both doesn't have enough time to go through all this method, so in that case, do you guys use this kind of method, or is there any kind of other method to find out?
Yeah, another wonderful question. Thank you very much. We still use differential diagnosis, but we may not be able to use all the different parts of it. So if a person comes in unconscious, you can't talk to them, right? But you may be able to talk to a witness if it was a car accident, maybe a police or somebody else in the car, to get a history. Examination then becomes more important than history. You examine the patient. Particularly, we take what are called the vital signs. What are the vital signs? Blood pressure, okay, pulse, how fast the patient's breathing, or the respiratory rate. Okay? So those are very, very important in a trauma or accident case. Does the patient have a normal blood pressure, or is it very low? Is their pulse, the heartbeat, how many times the heart is beating per minute? Okay, is it normal or is it high? Are they breathing normal or fast or not at all? Okay, so those are the vital signs. We also include temperature, thermometer, temperature. Those are the vital signs. So those would be very important to do quickly in an accident or a trauma patient that comes into the emergency room. Then we would rely heavily on laboratory. Okay. So if there seems to be a problem with the chest, we get a quick chest x-ray at the bedside in the emergency room. And we did that with this patient. Okay. Then we may need to get some blood or urine tests. So we draw blood, collect urine. Okay. So we rely on more the examination and the laboratory to make the differential diagnosis in an acute trauma, someone coming in with trauma to the emergency room. Very good question. So we use the same system, but it's not as complete as someone walking in with more of a chronic disease or if they're not so sick. Very good. Wonderful. Anybody else have a question? Please, yes.
During physical examination, most of the Western doctors use, as you said earlier, like stethoscope use, right? So in order
Yes.
to hear sound hear the sound from the movement of within the body, like heartbeat, etc. So another way to pulse reading, especially through radial artery. So from my own point of view, I think that the pulse reading, the beats, actually I think that using that instrument or equipment and reading, pulse reading to radial artery, I think that it's same because it diagnoses disease through heartbeat actually, if I'm not wrong, from heartbeat. So can you differentiate why do Western doctors use the stethoscope? So what are their functions? How do it actually diagnose disease?
Good. Good. Very nice question. The answer is long, but I'll try to make it short for now. And maybe later, if you like, we can discuss in more detail. We use the stethoscope on different organs. So for example, on the heart, when we place the stethoscope over the left side of the chest, we're listening for number one, the heart rate, which you can also get by checking the artery, for example, the radial artery. Number two, we listen for the rhythm. Normally the heartbeat is regular. It goes ba-bum, 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 ba-bum. Okay? We're listening if the patient has a regular rhythm like that. Or something that's irregular, not regular. We call that atrial fibrillation, like this. Ba-bum, 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 bum, 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 bum. Not regular. We call that atrial fibrillation. That we can determine by the stethoscope on the chest. Thirdly, we listen to the valves in the heart. How many valves are there in the heart? Good, good. How many chambers in the heart? How many rooms? 4. Good. So each room connects to the next room by a door. Okay? It's not exactly a door. We call it a valve. And it's a one-way, it should be, normally it's a one-way valve. So the blood can only go in one direction, not the other direction. In a diseased valve, the blood can go both ways, okay? So we're checking for the valves. So normally when you listen to the heart with a stethoscope, it's like this. Ba-bum, 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 okay? If someone has a disease in the valve, so it's not working just as a one-way valve, but as a two-way valve, you would hear ba-bum, psh, ba-bum, psh, ba-bum, psh. That shh is the blood going the wrong way, okay? Or you could have a problem where the valve is too tight. It's like the door doesn't fully open. So the blood has to squeeze through. And then you'd hear something like this. Ba-bum, psh, ba-bum, psh, ba-bum, psh. Okay? We call that stenosis. It means a narrowing of the valve. So the stethoscope helps us to discover valve disease in the heart. Okay? You have to ask your teachers. I'm not that good of a pulse diagnostician. From the modern medicine, no. From Tibetan medicine, yes. I'll give you an example. Little different, but close. Many years ago, Amji Tenzin Chöra, who was it? I forget now. I think it was Amji Tenzin Chöra. You know, yeah, from Menzikong. He's now passed. He, or Amji Yeshidundin, I forget which one now. We'll have to ask, okay. Was visiting Harvard Medical School. You know Harvard Medical School? Very famous, right? And he was going with the doctors to see the patients. And the doctors said, Amjila, would you like to check the patient? Amjila said yes. He sat by the bedside. I think it was Tenzin Chöra. I think so. Sat by the bedside and did not speak any English. And the patient spoke no Tibetan. Okay. But he was very gentle. And he sat by the bedside and he gently took the wrist. And he checked the pulse on one side, checked the pulse on the other side. Okay. And then he smiled at the patient and he left with the doctors. They went outside in the hall. And the doctors, the Western modern medicine doctors, they said, Amjila, what did you find? And he said, there's some wind going in the wrong direction. And the doctors, the modern medicine doctors, they kind of were surprised. It turns out the patient had a hole in the heart between the two major chambers. So the blood was going in the wrong direction. And he was able to discover that by the pulse diagnosis. Okay? The modern medicine doctors had to do all kinds of tests. Basically an echocardiogram. Okay, later maybe we'll talk about that. To diagnose it's called a VSD, a ventricular septal defect. Basically a hole in the heart between the two chambers. So yes, I think the good Tibetan medicine doctors can diagnose valvular disease or holes in the heart by the pulse diagnosis. I think it's possible. Okay? And many other examples of how we use the stethoscope. In the lungs, we listen to see if there's fluid in the lungs, for example. We can listen to the abdomen, the belly, and check the intestines to see if they're active, overactive, underactive, things like that. Anyway, it's a long, yeah, good. One last question, or are we finished? But please. Okay, please.
My question is about disease.
Mm-hmm.
I just want to know that in modern medicine, what is the basic concept of disease? I mean, how they consider the disease. What is the disease?
Wonderful. It's a wonderful question. There's the traditional view on this, and then I'm going to give you kind of a new view that I take. Okay? The old traditional view on what is disease is when you're sick, when things are not normal. So it's basically trying to figure out what's the problem and get you back to normal. Okay? My view is different. And a lot of doctors now, a new way of thinking is that the job of a doctor is not just to bring the person back to normal, but to go further, make them happy, help them make them happy. Okay? So we can, from the modern medicine standpoint, we can look at disease from different perspectives. Number one, we can look at the tissue, what's happening in the tissues or the organs or the cells. That's one way to look at disease. Okay? For example, cancer. If you look at the tissue of cancer, you see many abnormal cells. Okay? And that's called disease from the perspective of the tissue being the cells being abnormal in the tissue. Okay. If you look at infection, for example, then you would find in some organ some boo. And along with the boo, the infection, the organism, either bacteria, as I said, or virus, or parasite, or fungus, you'll have many white blood cells, which are part of the immune system trying to fight the infection. And you would see that in the tissue if you had a small piece of tissue. So that would be from the point of view of microbiology disease. Sometimes we make the diagnosis of disease based on imaging, an X-ray or a CT or MRI. You would see something that's not normal. So that would be disease from the perspective of laboratory, particularly imaging. Okay? You can also have disease from the perspective from things not being functioning well. The person comes in and says, I have trouble walking. Okay? So you would have disease on the basis of dysfunction. Okay? The function not going properly, in this case walking. So a little bit like that. It's a very good question. Very good question. In general, we would say something is abnormal. And it can be in the body. So mostly modern medicine, they mostly deal with physical disease. But I'm a Buddhist monk, so I deal with the mind all the time, right? The mind. Yeah. So I also evaluate emotional and mental disease. To me, that's very, very important. And the most important one, most common one, someone mentioned it earlier, is depression. Very common. And people usually do not go to the doctor and say, Doctor, I'm depressed. They don't do that. They go to the doctor and they say, Doctor, I can't sleep. Or, Doctor, I have a headache. Or, Doctor, I don't feel well. Or, Doctor, I'm having trouble in my relationship with my wife, my girlfriend, my boyfriend, something. Okay. They don't go in and say, I'm depressed. But 20% of people or more are depressed in the world. There's a lot of suicide. You know about it. Okay? And it's rising. The rates are rising. And that comes from severe depression. Okay? So I always look at not just physical disease, but also mental or emotional problems, such as depression and other things also. Very good. Good. So I think we're done for the day, huh? Good. Thank you very much. And it sounds like we're going to meet tomorrow, I guess. Is that? Yeah. Okay, good.
Okay, now I, on behalf of all the students, would like to give a big thank you very much for your kind and wonderful lecture.
Thank you very much. I thought you were all great. I didn't see anybody fall asleep. I saw a few people get bored for a while, but that's normal, okay? And you asked some very, very good questions. So thank you. We'll continue then tomorrow with the same. We stopped kind of in the middle of the case study, and we'll start tomorrow by going through the case study. Great. Thank you very much.